Hello everybody. For this video, I would like to discuss a very fascinating topic within the mental health field, and this disorder that I would like to go over is called schizophrenia. Schizophrenia is a Greek term, that literally translates to split mind. And it is very unique because it affects less than 1% of the population, and there are two categories within schizophrenia. There are different manifestations of these symptoms, so to speak. So there's positive and there's negative. Positive have to do with thought disorders, hallucinations, and delusions. So what it means is that if to simplify it, think about the plus sign with positive. It adds to the person's reality, whereas a negative is an absence of normal behaviors. So think of the minus, it'll subtract from those behaviors and from that person's overall demeanor. To go into depth, I'm going to reference to my notes since this disorder has such a unique spectrum. So the positive ones, the first one will be thought disorder. So there's irrational, unorganized thinking characterized by pressure of speech, like spontaneous speech, distractible speech, where the individual will hear speech in another voice that isn't theirs. It's very separate from your consciousness and that inner voice that we all have. It's another entity, so to speak, inside of that person's mind. And there's tangibility. So those are the different ways that it can affect the thoughts. The thoughts will be separate from your own. It won't even be necessarily you talking. I have had the pleasure to engage and meet somebody who actually had schizophrenia. And this individual was actually a person who was educating us about mental disorders, and they were educating a group of me and a couple other colleagues about different mental disorders, and they gave us a unique insight of what it was like to have schizophrenia. And this individual did have this unique symptom specifically, where they would have their own thoughts and they knew that they were separated from their thoughts, but underlying behind that was that spontaneous distractible speech in the background, and it was a different voice. It was not her own voice. It was just a constant intrusive voice that would basically bully this individual and constantly be intrusive into their day-to-day life and their own thinking process and their own actions and the actual speech going on around them. And there are some more severe cases, though. This individual did not have symptoms as severe as others. The more severe parts of it can awaken, for example, hallucinations and illusions. So the most common one, again, is auditory. That would be the most common hallucination that the individual with schizophrenia will experience, while there are others, or the second most common one is actually olfactory. It won't be visual illusions. It'll be smells. This person may smell different things that are not actually linked to that reality, that tangible reality ahead of them. The delusions that they'll have are a little bit more of a wide range of things. So there's delusions of reference, delusions of persecution, and the list goes on and on and on. But to be a little bit more specific of those different subcategories of delusions, like delusions of reference, for example, will be when people have a very separate reality from what is going on. So a delusion of reference will refer to the fact that some people who are extreme or have extreme beliefs believe that they were genuinely called upon by, and it typically happens with a religious thing, like a religious rite or a religious carry-on, and to a group of people. So this can be seen in exasperated people, such as, for example, somebody who wants to lead a cult and has that delusion of reference that the higher power that their message is for called upon them to carry on the higher power's actions or judgments or mission, so to speak. So, for example, perhaps a cult leader that has schizophrenia will truly believe that they were called upon by a god to carry on their mission, and they will lead these people believing that they're actually carrying on this mission, that they have been chosen to do so. And there's delusions of prosecution, and that links a little bit towards paranoia. So, the specific type of symptom manifested in a schizophrenic person will refer to this person believing that everyone is out to get them. And not in a low self esteem kind of way where maybe somebody doesn't trust people or is a little bit more reclusive. No, it's definitely in the sense where they truly believe and see and perceive that there are people actually after them. So that can be like, for example, someone who hallucinates that their apartment is bugged, or they have FBI agents after them, or they have a special force behind them, or spies that are intruding into their lives and listening to every conversation they have and every movement they have. And it goes far beyond that skepticism and fear of lack of privacy. It goes far beyond the irrational spectrum. It goes into an irrational barrier. And there's delusions of grandeur where a person will believe they are king, or they are above the law, or that they are celebrity, or they will make up their own reality in a grandiose way that does not live up to their own reality, and they will truly believe in it, not in the sense where they're being confident or ambitious like the typical and functioning way would be. It'll be to an extent where they literally are in their own reality with that. They literally believe they are a king or a queen, and it's completely separate from their true identity and how they operate in the real world. So those are a couple different delusions that go under that, and that is a last pinpoint part of the positive symptoms. Not positive as in good, but the positive additional things to add into the person's psyche. And the category of the negatives will be categorized in flattened response, speech poverty, lack of initiative, and inability to experience pleasure, and severe social withdrawal. So, whereas the positive symptoms kind of add a little bit to the reality of the individual, this will take away from the person's normal day-to-day functioning. This will take away from the normal brain functioning of an individual. It'll be catatonia, so to speak. It can manifest as a catatonic person, and it is very severe because of the fact that this individual is not functioning and simply not there. And the different causes for it, for example, with the negative symptoms, the reason why there's something lacking within their psyche and within their brain functionality is because it's very, very highly linked to the fact that there is brain damage going on. And I will go ahead and show you an example of what that looks like. And the reason why there will be in the positive category is because they are overactive and very, very high level of dopamine neurotransmitters within the person's brain, causing these hallucinations, these delusions, and background speech going on. So I will go forward and show you in different studies, the susceptibility and heritability of it are very prominent in twins. So if a twin is schizophrenic, it is very highly likely that the other twin will have it too. And it's less a recessive gene. It's a little bit more compatible with twins than anything. And for example, an MRI will show that a brain scan of schizophrenic individuals, and specifically from the twin study, shows enlarged ventricles and loss of gray matter. So I actually, in my textbook that I love to reference back to, by actually David Myers, if you ever want to get one of your own, here is a brain scan in comparison with the identical twin study. On one side, you will see a no schizophrenic brain, right? And then on the other side, you will see a brain scan of someone with schizophrenia. So I don't know if you can actually see it right there. Right here, you notice the ventricles are normal. This is a person without schizophrenia. Now, this is a person with schizophrenia. You'll see that the ventricles are enlarged, and so to speak, a term that people typically use for a schizophrenic brain is that the butterfly is there. And right here, if you see all of the gray matter within the brain, you'll see that it is very severely deteriorated in the person and patient with schizophrenia. So with this twin study, it just compared identical brains from identical twins, but in this case, the other twin didn't get it. The other twin wasn't susceptible, but they wanted to make sure that they had that control of inside their experiments that these brains are in fact identical. Now, referencing back to my notes, I would like to go over a little bit more of positive symptoms and how it has to do with dopamine overactivity. So these synapses in the mesolimbic pathway are just haywire at this point. So therefore, that's why it's causing all of these intense otherworldly experiences in the person, far beyond reality, so to speak. So there are medications that do help with that, and it's chlorpromazine. Chlorpromazine was actually discovered on accident to treat something else, but it ended up actually helping patients that have schizophrenia and symptoms of schizophrenia. What it does is that it helps regulate those dopamine neurotransmitters from going haywire and consuming the brain the way they do. Now, a lot of the pathway ends within it go through the amygdala, the nucleus accumbens, and that all has to do with the mesolimbic pathway. So it actually travels through your whole brain because a whole brain structure, or the majority of the pieces, are involved with someone with schizophrenia, and specifically those I just listed. So it is this chlorpromazine actually has to fix that neural pathway and neurotransmitter activity through all those parts of the brain, and therefore it changes the way the brain functions, as you can see. And whenever it comes to that was actually the first one, and it blocks those over excessive dopamine neurotransmitters. The best one is Clozapine, but the only downfall of it is that it is very expensive unless an individual is covered by a really good insurance policy, or they have a mental health clinic that provides a little bit of a better accessible resource of it, which I wish it was a little bit more tangible and a little bit more in reach for people that have schizophrenia, because it blocks those dopamine 4 receptors in the nucleus accumbens, which is where it tends to like to lurk around. It's very effective, and it goes hand in hand with some blood work monitoring. Now, a lot of schizophrenic patients undergo therapy as well, but given the fact that this has a lot to do with the brain chemistry itself, it is very important to get to that root of the issue first in order to get the person into a coherent enough state to be able to kind of depersonalize themselves from that alternate reality that they are in, that their schizophrenic brain put them in, that is very different from our current reality. There are manifestations of schizophrenia other than just hallucinations and a bit of a individualistic experience. If you see an over behaviors, it is known as terrative dyskinesia. And whenever this typically happens with the person that has the negative symptoms. So there's something in their brain that's causing them to have these involuntary movements, and it has to do with this person will have tics and they'll have constant moving or shaking, so to speak. So not only will they be catatonic, but they will be like kind of just shaking and muttering to themselves because of the fact that this is just the way it chose to manifest. And there are many other theories. There are very interesting theories that you can look into in articles and journals, psychological journals, so to speak, and medical journals. A lot of people have theorized that it has to do with the season of birth. There have been research studies based upon that. I don't know how valid those are, but there have been very intriguing theories behind it. So somehow it is linked that the incidences of it are related to the season. So people that were perhaps born between February and May could be an outlier to the circumstances within it. There is also urbanization kind of research projects around it, maybe seeing if there are certain environments are a little bit more vulnerable to schizophrenic people or not. Maybe it has to do with an environmental factor too, something a little bit outside of the brain structure. And there's a lot of theories that really point to maternal malnutrition as well. So that link all the way back to the way the baby was raised or the way they developed in the womb, whether it may be linked to diabetes of the mother, some sort of Rh incompatibility, which affects the baby in the womb from the get-go. Some developments, some complications during labor and delivery have been correlated with some schizophrenic symptoms. Some brain development issues, such as a dorsolateral prefrontal cortex, which also exacerbates those negative symptoms, the hypofrontality and such. And I want to also go over, there are 4 different types of categories within schizophrenia, and I would like to really go over them because schizophrenia isn't as simple as it is. That's why this is such a fascinating topic and why it needs to be backed up by so much research and so much notes that I have. So the subtypes of schizophrenia, there are 5. There is paranoid schizophrenic, disorganized schizophrenic, catatonic schizophrenic, undifferentiated schizophrenic, and residual schizophrenic. So to put it in simpler terms and to simplify the ways that schizophrenia can be categorized and the ways that different positive or negative symptoms can be manifested, this is the best way of putting it into boxes, which is the subtypes of schizophrenia. So with the paranoid subtype of schizophrenia, it will have to do with the preoccupation of delusions or hallucinations. So that goes back to the whole persecution and grandiosity inside of an individual, that inflation that is there. So the paranoid schizophrenia is a little bit more of the FBI link, the bugs in the apartment. There's something going on. There's someone spying on them. There's an invasion of privacy going on. There's celebrity with paparazzi, stuff like that. Now, disorganized schizophrenia has to do with disorganized speech or behavior, so that one's a little bit easier to link in, and flat or inappropriate emotions. So disorganized schizophrenia is a little bit more in the realm of the negative category. So there won't be speech development there or coherence with the person's speech or their emotions or just their overall reactions to their outside world. Catatonic schizophrenia also goes into that category of negative symptoms. It's the immobility, extreme negativism, and a repeating of speech and movements. So it also goes hand in hand with that jittery movement that may occur with people that have schizophrenia. Like I said earlier, that specific realm of it will cause jerk-like movements and repetitive movements, and they will also be catatonic. So that's when you can very well pinpoint a catatonic schizophrenic individual. Undifferentiated schizophrenic is a little bit, that's the way you would categorize somebody who has a little bit of an exacerbation of a couple mixed things that can't be pinpointed or can't be summed up in that one specific subtype. So undifferentiated is a way of putting all the varied symptoms together. If an individual is showing a little bit of an overlap with the different subcategories of schizophrenia. Residual schizophrenia has to do with withdrawals and after hallucinations and delusions have disappeared. So residual schizophrenia would be like the aftermath, possibly, like it could even possibly be a stage in someone being treated with schizophrenia. It'll be that in-between stage where the hallucinations and delusions are no longer there, but it's just like the residue of it in that sense, if that makes sense. So it's a very, very fascinating disorder. Schizophrenia is very, very fascinating, and it's really, really, I think it captures the uniqueness that psychology can offer and the uniqueness of this topic, and I feel like that's what attracts people the most to psychology, is understanding ourselves and understanding others. But this disorder has a lot to do with what our brains can do to our reality, how interesting it is to see a brain take over the owner of the brain, and how it can change the reality into something completely different. And with schizophrenia, while it's more rare, it's important for us to seek help for those individuals because of the fact that they are not coherent enough to be in that current reality. Their responses, their perceptions, and their actions will not align with what's appropriate with reality. So it's easy for these people to be taken advantage of because a person may misunderstand it, may be very confused or stigmatized, and it can cause people to be in very dangerous circumstances or be in danger because while their reality and their viewpoint of life is completely different than the individual persecuting at them or attacking them, it can cause a lot of conflict, and it can cause actually the schizophrenic person to be more in danger than what people think. While people might think that these people are more dangerous, the fact of the matter is that while we hear a little bit more about dangerous schizophrenic people, the frequency is that those people are actually more vulnerable and in danger from other discriminatory people. So just keep that in mind. This is again why we're educating ourselves. This is again why we talk about these things, to make sure that we don't have an incident where someone is misunderstood and treated illfully or hurt during a circumstance like this just because someone doesn't understand the way their brain works. So just remember, a person with schizophrenia does need help because their reality is very different than ours. It's not something that they can just do by themselves. They definitely do need the help in order to overcome this and get through it. And it's very important to understand that these people need to be safe from themselves and from others more than anything. So thank you for educating yourself upon this matter, and thank you for watching the video thus far and all the videos thus far. Have a good mental health day.